So today, we're going to dig into something pretty shocking, a hidden link between one of the most common vitamins out there and one of the most terrifying mental health symptoms you can imagine. Let's jump right in. It sounds almost too simple, doesn't it? The idea that a severe psychological issue could be completely fixed, not just managed, but totally resolved just by plugging a nutritional hole? But what if I told you this isn't some hypothetical? It's a real, documented medical fact.
I mean, just try to imagine that for a second. It's the stuff of nightmares, but that's a direct quote from a medical report describing what a patient was actually seeing and hearing. Now, your first thought, my first thought, anyone's first thought, would be, this has to be some kind of major psychiatric disorder, right?
But here's the twist. That assumption was completely wrong. The root cause of these horrifying visions wasn't schizophrenia or some other deep-seated psychoses. It was a straightforward but severe lack of vitamin B12. And that right there is where our story really takes off.
So you have to ask, how strong is this connection, really? Well, let's unpack the evidence. We're going to be looking at what a major systematic review of 50 different case studies stretching all the way from 1960 to 2023 has brought to light. First, just a super quick refresher. Vitamin B12, you might also see it called cobalamin, is an absolute workhorse in our bodies. It's essential for making our DNA, for building red blood cells, and, this is the key part for what we're talking about today, for keeping our entire nervous system healthy and functioning properly.
So when we talk about treatment, how well does it actually work? Well, the data all points to one incredible number, 75%. And what that number stands for is pretty staggering.
Yeah, you heard that right. In this massive review we're digging into, a full 75% of patients had their hallucinations completely disappear after they were treated with vitamin B12. And we're not talking about years of treatment. For most, the recovery happened within just 2 months.
But here's what's absolutely wild. For a quarter of these patients, the B12 worked where really heavy-duty psychiatric treatments had totally failed. These were people whose hallucinations didn't get better with antipsychotic drugs or even with electroconvulsive therapy. And yet, a simple vitamin held the key to their recovery. And listen, this isn't just some dusty old medical trivia. Take a look at this chart. It's straight from the study itself. It shows the number of published reports on this topic, decade by decade. See that huge spike starting in the 2000s? That tells you the medical community is really starting to sit up and pay attention to this. Okay, so the connection is obviously real and it's powerful. So the natural next question is, who's actually at risk here? And the answers might hit a little closer to home than you'd expect.
The traditional risk factors are still out there, of course. But what researchers are really zeroing in on are two huge trends in our modern world that are making B12 deficiency a much bigger conversation.
On one hand, we've got the incredible, and I mean incredible, rise of plant-based eating. It has tons of health benefits for sure, but it can also cut out the main natural food sources of B12. And then, on the flip side, you have something a bit more, well, alarming. The increase in recreational use of nitrous oxide, or laughing gas, which can just torch your body's B12 supply incredibly fast.
And this is a really critical piece of the puzzle. You see, doctors have traditionally looked for something called pernicious anemia as the classic sign of B12 deficiency. Basically, it's when your body can't make enough healthy red blood cells. But the data shows that less than a third of the patients having these hallucinations actually had it. What that means is the hallucinations themselves can be the very first and sometimes the only warning sign that something is wrong.
All right, now we're going to get into a really cool kind of bizarre piece of biology that explains why we're so vulnerable to this in the first place. It all comes down to a strange little paradox happening inside your own gut.
Now, I know what some of you are probably thinking. Hang on a second. Don't I have bacteria in my gut, and don't they make B12 for me? It's a great question, and the answer has a fascinating biological twist. And the simple answer is, yeah, they do. But, and this is a huge but, it's not for you. The B12 they make is almost completely useless to us. Let me explain why. See, for us to actually use the B12 we eat, a very specific chain of events has to happen. When you eat B12, it goes to your stomach, and a special protein called intrinsic factor grabs onto it. Think of it like a key in a lock. This whole package then travels down to your small intestine, and that's the only place it can be absorbed into your body.
And that right there is the whole problem. The thing is, those helpful little bacteria that make B12, they live down in our large intestine. But the place where we can actually absorb B12 is way upstream in the small intestine. So our body makes this great stuff, but it's basically produced past the point of pickup. It's too far downstream for us to use.
All right, so we now know we can't count on our own gut bacteria. We get the risks, we've seen the science, so let's talk solutions. Let's get into a clear, actionable plan to make sure you're getting what your brain and body need.
First things first, let's bust a few myths because there's some dangerous misinformation out there. You've probably heard that you can get B12 from things like unwashed veggies or fermented foods like tempeh or even seaweeds like spirulina. Look, the experts are really clear on this. These are not reliable sources, period. So what actually works? It really comes down to three things. You can get B12 from fortified foods. Think of a lot of plant milks, nutritional yeast, or breakfast cereals. You can take a dedicated B12 supplement. And of course, you can get it from animal products, which is where it originates.
And if you're on a vegan diet, the experts have some really specific advice to make it easy. You can either take a small dose, about 250 micrograms every single day, or you can take a bigger dose of 1,000 micrograms just a couple of times a week. And the reason these doses seem so high is because our bodies are actually not that great at absorbing it, so you need to take more to make sure enough gets through.
Okay, and one last thing, and this is a really, really important warning, especially if you eat a lot of plant-based foods. These diets are usually loaded with folic acid, which is a good thing, but high levels of folic acid can actually mask a B12 deficiency. It basically fixes the anemia, which is like turning off the fire alarm while the fire is still quietly burning in the walls. You're silencing the main warning sign while serious and maybe even irreversible nerve damage is still happening in the background.
So when you step back and look at it, it's just a powerful idea, isn't it? A truly devastating mental health symptom that can come from a simple lack of a nutrient and that has a simple solution. It really makes you wonder, what other vital connections between what we eat and how we think are we still completely overlooking?